I've been asked many questions about our Working Well program at Lawrence County Healthcare System, so I thought I'd share those questions with you and talk about the things that we've been doing. First of all, how has Working Well helped your hospital? Well, everybody's familiar with the triple aim, and the triple aim is as part of the process to improve the health of the population. Our employees are part of that population, and so Working Well has raised awareness of good health. As a hospital system, it's important that we take the lead in our employees' health, so we implemented the Peak Health program, where employees receive an annual health assessment and blood work. Based on the outcome, that they are graded on a basis of 1 to 5. If they're a 1, they pay a higher premium, and if they're a 5, they pay a lower premium. The average started at 2.3 in the first year, and we've achieved in 2 years the average of 3.27. Have we seen a decrease in employee costs per claims? We use a program called My Catalyst. This program evaluates the cost of claims over time. We're now in the 3rd year, and our 2nd year data shows a decrease in cost for certain medications and diagnoses of almost 9.7%. You're a small rural facility that created a wellness initiative. How are you able to finalize and justify this expense? Frankly, there was no expense involved. If we reduce the use of healthcare services for employees, that's enough of a reward and enough of a return on investment. Have you seen or do you expect to see a positive return on investments in joining Working Well in creating a culture of wellness at Lawrence? Yes, as I stated earlier, we went from an average of 2.3 to 3.7 on the scale of 1 to 5 over a 2-year span. And of course, the employees are well on their way with regard to being aware. And I see an increase in the sale of the nutritious food choices in the cafeteria. Tell us about your wellness program and why you think it's been successful. Well, from its onset, our Working Well program has been innovative. It's been energetic and very successful. We have special events, newsletters, workshops, seminars, and they've all added to the mix to make an exciting program for the employees of Lawrence County Healthcare System. You are gold in 2 Working Well pillars, tobacco and nutrition. What does this mean to you? We were one of the first hospitals to go tobacco-free in South Carolina, and have shared our successes with many in the South Carolina Hospital Association that have requested our action plan and communication plan that made that happen. It's terrific to be recognized for these efforts, and things continue to go very well. With regard to nutrition, I give full credit to our dietary department for creating programs internally that make a difference. The Golden Apple Award was exciting recognition to all of us. We have healthy meal choices each day, which is really nutritious and less expensive than the other selections. It's the cheaper meal. Make it even more enticing. We've just started offering to the community a program called Create Your Weight. It's a management program, and we have a full class ready to start in another week or so. How do you approach your role in providing executive leadership to support and model wellness in your organization? It's really simple. First, you have to practice what you preach. I try to maintain healthy habits on my own, although it's difficult at times. I participated in the Peak Health program, and I was the first one to receive the full health assessment and achieved a score of 5 and maintain that 5 to this day. Lastly, I empower people to do it and take a leadership role in all the actions of the program. Lawrence County Healthcare System doesn't have a dedicated staff person whose role is employee wellness. Explain how have you been effective with an active wellness team in partnership with your wellness service provider. We found a wellness team with members including employee health, nurses, human resources, and public relations staff. And they work together as a committee to oversee the program. It's part of the culture and has been hardwired into our organization.